Hello, everyone. My name is Tiara Brooks, and here at School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Creating School-Wide Conditions for All Students to Thrive, Part 1, our introduction. Today's presentation would discuss furthermore on our Hallways to Health toolkit. But before we begin, we do have a few housekeeping reminders. First, all attendees are in listening-only mode. However, we want to hear your questions. At any part during the webinar, please enter your questions into the chat box in your Zoom control window panel. Also, at the end of this webinar, we will have evaluation poll questions. If you can please answer these evaluation poll questions, as webinars like this will help us to do more webinars for you in our future. We also have our raise hand toolbar. To also engage with all participants for some questions during the webinar, we will encourage all of you to use the raise hand feature. If you click raise hand in the webinar controls, this will raise the hand and turn green. To lower the hand, you click the same button. Also, as an alternative, you can use Alt-Y. This will raise and lower your hand. Let's begin using our chat box. If you are viewing as a group only, please go to the chat window in the chat icon and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. The School-Based Health Alliance is the national voice for school-based healthcare. We support school-based health centers through technical assistance and training. We advocate for school-based health centers on the federal, state, and local levels. We demonstrate the value of SBHCs with common standards, measures, data, and research. I would now like to introduce to you our presenter for today, Ms. Jordana Snyder. And Jordana manages at the Alliance our Hallways to Health initiative. I will now turn it over to Jordana.
Thank you so much, Tiara. Let me go through our objectives today, and then we'll begin with a little bit of a warm-up exercise for part 1 of our Hallways to Health webinar series, all about school-wide wellness. So today we're going to define school-wide wellness. We're going to understand and describe the benefit and role of school-based health centers beyond the clinic walls as learned through Hallways to Health. And then we'll be able to list 2 approaches Hallways to Health sites took to improve school-wide wellness. Let's begin by defining school-wide wellness. We'll start with a warm-up to get us thinking about this term and what it is. When we talk about serving your whole school population and advancing health equity to promote health and wellness for all students, we're going to use the term school-wide wellness. You may have heard of it as population health. We'll use this term, school-wide wellness, to describe interventions and services that are accessible to the school population beyond the type of services only available to your patients in a clinical setting. Tiara is now going to launch a poll, and after each question, I would like you to answer the question, yes or no. Would this effort constitute an effort towards school-wide wellness? Go ahead, Tiara.
All right, and our first question, clinic does annual screening for BMI, identifies 5 students who are overweight.
And the second part of that question also is that after identifying those 5 students who are overweight, the clinic works to provide 3 nutrition group sessions for those 5 students. Okay, so folks have weighed in. The majority of people say that this is a school-wide effort. Can someone please write in the chat box why you think it might be considered a school-wide effort? And for those of you that wrote no, write something you might do to make it a school-wide wellness effort. So if you said yes, why do you count this as a school-wide effort? And if you said no, what might you change to make it a school-wide effort? Okay, well, since this initiative is serving a small group of people who come into the clinic, but then making a wider intervention available to the folks who came in there, it is an effort that does touch more than just one patient at a time. Someone wrote, in a clinic setting, the chances of those returning to a group training are very slim. This is more likely in a school environment. I agree. I think that this is a great intervention to do. However, it's not necessarily accessible to all the students in the school. Even though it is helping students with obesity by having the group, this is still a clinic-based intervention. So again, we want to think about in this webinar series how we can move beyond the clinic walls and move beyond serving just the patients who walk in our doors. What might you do to make this accessible to all people in the school? All right, and now we will launch the second poll question. So again, would this effort constitute school-wide wellness effort? So this question is, as School-Based Health Center A closes, School-Based Health Center B works with the school district to arrange bi-weekly bus transportation for students in School A to be transported to School-Based Health Center B for services. Just let us know if you think this is a yes or a no. Okay, great. Several of you said yes. This is definitely a school-wide effort, because even though you're transporting students to clinical services, it would be accessible to all the students in School A should they choose to enroll in the clinic or not. So the transportation services would be available. And these are the types of efforts that Hallways to Health sites have gone into. We'll do just a few more. So next question, please, Tiara. Great. So this question says, School-Based Health Center works with the school to designate one day of the week or month as Medical Backpack Day, where health and medical information forms will be sent home with the students, and parents know to look out for this correspondence. Do you think this is a school-wide wellness effort or not? Great. The majority of you said yes, absolutely. When we're making health information available and accessible to all students and communicating with parents and guardians and families about information for the students, and that is centered around the whole school population, these are definitely types of initiatives that are school-wide wellness initiatives. So thank you so much for participating in those warm-up polls. That's great. This is just to get you thinking about what you might already be doing that constitutes a school-wide wellness effort as a part of your SPHC operations, which you may not have thought about prior to today. So now I'll tell you a little bit about the Hallways to Health initiative. Great. So school-based health centers provide access to high quality and timely care, improving student health and academic outcomes. At the School-Based Health Alliance, we advocate for this model nationally and locally and provide training and technical assistance to the field. Hallways to Health from 2012 to 2017 was a learning collaborative that is a part of Kaiser Permanente's Thriving Schools Initiative and Community Benefit Program. In this initiative, 13 school-based health centers were supported by the School-Based Health Alliance and their state affiliate offices to improve school-wide wellness, which we already spoke a little bit about. We provided training and technical assistance to the sites, creating space and time for building relationships and to engage in rich learning and sharing across sites. Schools with school-based health centers are in a particularly unique and strategic position to improve student and school employee health. School-based health center staff, though, have focused their work mainly on the individual. Hundreds of students are seen daily for all types of chronic and acute health issues. With this kind of exposure, SBHC staff understand the landscape of met and unmet student and school employee health needs and social determinants which drive them. For school-based health centers to realize their full potential and impact, they must expand their role beyond the clinical setting alone and bring their knowledge and expertise into the wider school environment. In Hallways to Health, we tested the role that school-based health centers can play in school-wide health promotion and prevention. The goal of the project was to build the skills and practices required for school-based health centers to facilitate improvement in health amongst students, their families by extensions, and schools in 3 domains: healthy eating and active living, social and emotional health, and workplace wellness for school employees. Our aim is to move beyond the clinic walls to create and foster the systemic conditions, values, beliefs, norms, policies, and even practices that promote health and enable all children to thrive in school. We had 13 sites participating in the Hallways to Health Learning Collaborative. Part of the initiative was to provide microgrants to these sites to offer support for these efforts. Many of these sites chose to fund a position of health educator or expand the role of other school-based health center personnel to implement Hallways to Health. But we don't think that that is a requirement for doing school-wide wellness work, and we'll talk more about that later in our webinar today. So these school-based health centers are located in 5 states, as you can see: Oregon, Washington, California, Georgia, and Maryland. And they're all a mixture of elementary, middle, and high schools. And not only are they different demographically, but also geographically. 4 of the sites are suburban, 7 are in urban areas, and 2 are in rural settings. I share this list both to thank and acknowledge these innovative school-based healthcare leaders who tried this model on over the last 4 years and whose stories will comprise our toolkit, but also to show you where your sites might have similarities. We know that wellness is determined in great part by where children live, learn, and grow. Recognizing this, schools across the country are collaborating to create a culture of wellness that extends beyond the health clinics and into the school hallways, classrooms, cafeterias, teachers' lounges, and other campus spaces. Hallways to Health lies at the center of need and opportunity to address factors that enable or inhibit healthy lifestyles. Schools are at the epicenter of family and community health. They are hubs of community engagement and mobilization. In fact, as the comic shows, schools can be barometers of social issues and factors as well. It makes sense then that schools should be utilized as accelerants of opportunities and to intervene at critical stages of child and adolescent development. By engaging in school-wide wellness efforts, our Hallways to Health sites were able to address school-wide health in the following ways. They conducted school-wide risk assessments for students and for staff, expanded touch points within the school, serving broader student bases and indirectly increasing SBHC utilization as a result, creating stronger linkages to community-based organizations and in-school partners, prioritizing the health of those who educate our youth and serving new populations by serving school employees, changing school climates, improving school wellness policies and healthy eating, active living, and even for school employees as well. Building new infrastructures like gardens and tracks, introducing new health education and curricula into schools, including social and emotional learning curricula, nutrition curricula, bullying curricula, They also expanded access and distribution to breakfast, after-school snacks, weekend food and water, and helped reduce truancy and discipline. We're here to expand our thinking about what our school-based healthcare work can really make possible for our school communities. You are already providing much-needed clinical services and social services to so many youth who wouldn't get them otherwise. This is a real opportunity to think about maximizing our impact, moving beyond the clinic walls to create the conditions for youth, school staff, and families to thrive. So as any good project ends, we wanted to evaluate and make sure that this initiative and this model was making a difference. Our final evaluation of the Hallways to Health initiative focused on key questions. The first was, is there increased engagement and integration by school stakeholders in school-based health center clinical and school-wide efforts? And we knew from the very first years of Hallways to Health that maximizing SPHC's potential to advance school population health requires systemic changes through the work of the school-based health centers and the active support and involvement by the education leaders, lead agencies, and other community stakeholders. So we wanted to see how supportive and involved they really were. Second, we wanted to know if the schools successfully implemented sustainable policies, protocols, and programs in their school-wide efforts. We also wanted to make sure at the end of the initiative that we could determine what would continue. To answer these questions, we used two main methods. We surveyed 60 stakeholders to assess their perceptions of the impact of Hallways to Health on stakeholder support and engagement, as well as the implementation of school population health programs, protocols, and policies. Second, the sites provided us with detailed descriptions of both clinical and school-wide programs, protocols, and policies across each of the three domains we just talked about. And they also reported on the likelihood of their sustainability. The first thing we looked at was stakeholder support and involvement from before Hallways to Health to after. We saw large increases in the percent of stakeholders agreeing that school administrators were involved in school-wide efforts from before to after. Nearly all respondents agree that today school administrators are supporting school-based health center efforts, providing requested support, promoting school health policies, and even meeting regularly with SBHC staff. This is truly fantastic for busy school administrators to take an interest and an active role in school-wide wellness efforts. This change was significant. The administrators also began to see that school-based health centers were helping their student bodies and schools to achieve their academic outcomes as well. Although the survey results don't show it, every site said that by engaging in these school-wide efforts, they improved and strengthened their relationships and trust with administrators, and those relationships enhanced the SBHC's ability to get support for other SBHC initiatives. Guess what? We saw the same results for school-based health center staff. All of these changes are today a result of Hallways to Health. The majority of the people surveyed agree that school-based health center staff are now communicating with school staff, involved in decision-making, and sought after by the school or the district, and serving as part of school-wide wellness committees. All of this is to improve school population health outside the clinic walls, and it was all significant. We also saw the same results for teachers. Significant increases in agreement that teachers are involved in school-wide wellness. They were referring students to the school-based health center, participating in SBHC-sponsored activities, and allowing precious classroom time for SBHC health education presentations. And students were also significantly more involved in school-wide health efforts following Hallways to Health as they were before. So that included participation in planning and giving feedback to school-based health centers as well. All of these demonstrated that Hallways to Health efforts were related to school-based health centers being better integrated into our schools. This is, in fact, one of our SBHC core competencies. Other outcomes included decreased absenteeism, suspensions and expulsions, decreased stress among students and staff, peaceable conflict resolution, safer schools, increases school connectedness, more opportunities for healthy and nutritious foods and physical activity. So we learned in this initiative that good health can't be achieved just by a clinic visit alone. We also learned that co-location of a school-based health center, while wonderful, is not the same as effective integration of the school-based health center into the school culture. We know that your school-based health center staff and sponsors have a ton of expertise, but are often underutilized, not considered, or left out of the planning and wider conversations around school health. We know that you have data, quantitative, qualitative, and anecdotal, that provides a cross-sectional snapshot of students' health, and that as a model, school-based health center staff can bring attention to the issues that these data show, and can be a part of and should be a part of the key collective process. So now we get into the fun stuff. I'm going to just share with you quickly a little bit of a snapshot of what some of our Hallways to Health sites did in two of the focus areas: healthy eating, active living, and social and emotional wellness. So some of the population health approaches our sites took around healthy eating and active living, and you could see some, I divided it, the left side is school-wide, and then the right side is thinking about even in the broader policy or systems. So they included nutrition, or cooking classes or wellness classes, school-wide awareness campaigns, obesity prevention in health class curriculum. At a systems level or policy level, they included food insecurity screenings, BMI screenings, cultivating school gardens and getting students involved in that, creating healthy food policies, creating physical activity programs before and after school, and creating alternative breakfast options. In the chat box, can you give an examples if any of you are doing programs like this? Okay, we noticed that some of the content is being blocked on the slide, so we'll try and move our chat box to address that. Great, okay. Hopefully that should be okay. Okay, great. So some of you said you're already doing BMI screenings. Great, thank you for letting us know. And others of you are learning to garden and doing food back programs. Awesome. So you're already doing obesity prevention. Great. Probably through health education and things like that. Yep. All of these are really great to think about. And they don't often come up in how you necessarily talk about your school-based health center work. So that's awesome. Great. I'm going to share one of my favorite stories with you that one of our sites took for healthy eating. Great. So at Milwaukee High School in Milwaukee, Oregon, every student has access to an alternative breakfast. This focus expanded program came from our 2015-2016 Hallways to Health work, where the students were surveyed at the school about food insecurity. They found that 45% received free or reduced meals, and 18% admitted that they ate less than they thought they should because there wasn't enough money to buy food. And many of them said that they don't eat the cafeteria breakfast because transportation didn't get them there in time. The school-based health center, as a part of the Hallways to Health initiative, advocated to the school, the district and the district nutrition provider to pilot an alternative breakfast program for healthier food and offering it well into first period. The SPHC medical provider and students worked together to decide what should be served. They've seen an increase in numbers of breakfast consumed as the program progressed, and as a result, the district nutrition provider, Chartwells, has taken on and runs the alternative breakfast program. They provide both the food and the funding for this effort. To complement this, the School-Based Health Center created a policy and protocol to screen all students who come in for a clinic visit for food insecurity. The School-Based Health Center will continue to educate students on how to access and utilize the alternative breakfast program. Another one of my favorite programs is one of our sites had a school garden. So at Lara Garcia Chandler is one of our Hallways to Health champions at Ray Elementary School in Costa Mesa, California. So she said, she shared this quote, "It's been extremely fulfilling and satisfying. The children are just drawn to that garden. It has provided so many benefits outside plant science and nutritional education." She said this quote about witnessing a student and reflected on witnessing a student learning something about themselves, connecting it with the health information that they've learned, and making a change in the behavior toward healthier lifestyle. She said that's the most meaningful part of her work. Students and families at Ray lack access to supermarkets within walking distance, and families live in an apartment without adequate space, and oftentimes lack supervision for children to be physically active as well. In response to this challenge, the School-Based Health Center, as a part of their Hallways to Health efforts, revived the Ray Vegetable Garden to provide students with opportunities to learn about where healthy food comes from, learn teamwork, and even a sense of ownership. The garden allowed the students to taste fresh vegetables and even take home the produce. Laura remembers seeing one student carrying a zucchini like a baby, proudly bringing home food to her family. Here are some of the social and emotional learning approaches that our Hallways to Health sites used. Again, you can see that there are school-wide approaches and there are also policy and systems level approaches. So they include conducting school-wide screening for ACEs, conducting healing circles and other behavioral health groups, offering dance, yoga, and mindfulness programs, and other school-wide mental health programs, and teaching stress reduction techniques, both to students and to teachers. And the policy and systems approaches include using restorative justice practices in place of suspension and detention, referring to having school administrators refer to the SPHC for conflict mediation, hiring clinical social workers, and creation and involvement of wellness committees. So we see that from before the initiative to today, significantly more respondents reported that the student social and emotional wellness programs, policies, and protocols were fully in place. So one of my favorite social and emotional programs was the mindfulness program at Northwood High School. So the Northwood High School School-Based Health Center, located in Silver Spring, Maryland, is working in partnership with the school to make Northwood a mindful school. The population at Northwood has tripled in its immigrant and refugee population in the recent years, and the students face a lot of stress and trauma from seeing violence in their own countries and neighborhoods. One of their proudest accomplishments in Hallways to Health to move outside the clinic walls was to create a sustainable mindfulness program, protocol, and policy. Our Hallways to Health champion, Kay, talks about how these tools have been shown in scientific studies to make a difference, to lower blood pressure, lower anxiety and depression, and to change behavior in schools. She feels strongly that these tools should be offered to her students. At Northwood, mindfulness is also used as a means for restorative justice. The wellness team, composed of the School-Based Health Center personnel and folks who work on positive youth development, approached the school administration and proposed mindfulness workshops as alternatives to detention. This aligned with the county focus on restorative justice over punitive actions. Once a student is referred to detention, the dean of students seeks permission from parents, and the students come to the classroom some afternoons where they start with yoga and to release some physical energy. Afterwards, they do some deep breathing, and then they learn skills to reflect on what's happening inside them. Kay shares some of the results with us. After just 1 hour, students changed their responses from, "I feel completely a mess," or "I'm on top of the world," to "I'm calm and focused." The mindfulness program is continuing this year as an alternative to detention. There are also other mindfulness opportunities throughout the Northwood School, so offered in the AP classes, offered in the alternative education classes, in Spanish classes, as well as open meditations who are available to any student or staff in the school to attend. So in addition to hearing about these wonderful efforts, and many of them you'll hear about in a programmatic way, it's important to note that many of our sites also reported one sustainable, at least one, if not more, sustainable population or school-wide wellness level program, policy, or protocol. And many of these were not just programs, but actually were policies that had a systemic impact as well. So sites have done a really great job at putting protocols and policies into place, expanding them and helping to implement them. This includes also, even though clinic operations isn't necessarily the focus of Hallways to Health, many clinical practices have been complementary to or enabling the school-wide wellness efforts. And many shifts have occurred in a way that school-based health centers operate around school-wide wellness as a result of this grant. I did enough talking for a little bit. Now we're going to see a video from one Hallways to Health leader and to hear a little bit about one of the policies that she put into place.
My name is Aurora Chavez. I am the health educator for Northeast Valley Health Corporation's school-based division. Our school-based health center is San Fernando High School's Teen Health Center, and that is located in San Fernando, California. We have predominantly Hispanic students. It's about over 96% of the population are Hispanic, and most of the students qualify for the free and reduced lunch program, which means that all students will get free and reduced lunches. So one of the programs our wellness team has been able.
Sorry about that.
My name is Aurora Chavez. I am the health educator for Northeast Valley Health Corporation's school-based division. Our school-based health center is San Fernando High School's Teen Health Center, and that is located in San Fernando, California. We have predominantly Hispanic students. It's about over 96% of the population are Hispanic, and most of the students qualify for the free and reduced lunch program, which means that all students will get free and reduced lunches. So one of the programs our wellness team has been able to do is that with a collaboration between the Restorative Justice Program, the deans, and the administrators, we all felt that we wanted to increase class time as much as possible. And a way that we could do that was to decrease suspensions in school. The number one cause of the suspensions in our school is due to marijuana use. And so we were able to create an alternative suspension program where if students were caught with marijuana or they had a minor substance abuse offense, they were then referred to our Teen Health Center, and they had then to provide a contract with their dean that states that they're going to attend 4 mandated sessions with the behavioral health therapist, and that's something the parents are involved with as well, so the parents know that this is occurring. This is a way that we ensure that the students are able to stay in school and still get their education while still connecting them to behavioral health services on campus to provide them that support that they need. We were able to use everybody's strengths and use them together to create this program, and making sure that the students also felt very involved. So I was able to get feedback from the students later on to see what they felt was beneficial to the program, what they didn't, what they think we could change. Our restorative justice coordinator actually had to leave the school, and part of his transition in leaving the school was to make sure that we created sustainability within the program. We were able to create this contract with the administrators, so that administrators of the school really support this program because they have seen the benefit of it, and we have been able to increase the visits in the clinic as well due to the program, so it benefits us as well. We definitely still communicate regularly with the deans. I check in with them every 3 months to make sure that the students have come in through the program and if they have any issues or questions, so that is how we plan to continue the program. The biggest challenge that we face with implementing the restorative justice program is just that with teenagers, it's really regular for them to experiment, and I think it's just part of development that they will continue doing. And so it was then coming in from an approach, a holistic approach, that we want to provide them with alternative ways to manage their stress. It's really just a challenge with everybody growing up. Advice I would give is to make sure that all bodies are in the program and everybody is collaborating together. we were able to use everybody's strengths and use them together to create this program, and making sure that the students also felt very involved. So I was able to get feedback from the students later on to see what they felt was beneficial of the program, what they didn't, what they think we could change. So it's making sure that we continuously evaluate the program to make sure it is successful.
Great. Feel free to write in the chat box any reactions to Aurora's story about her restorative justice program policy, and what resonated with you. As you've started to hear, our Hallways to Health sites have had great successes so far. Now we're working towards national scale up, and that's where you come in. So thank you so much for joining us today. Healthcare is changing. There's a lot of pressure on the healthcare system to change the social determinants of health for our children and adults, to move upstream, to address root causes, to address ACEs. It's asking us all to think differently about health. And it will require new paradigms, new skills, and intentionally cultivating new partners, not necessarily traditional partners or in historic practice for clinicians. But we believe that schools have a critical role in these efforts as well. And Hallways to Health sites, as you heard Aurora talk about, and in our other stories, found that engaging in these efforts benefited school-based health center practices too. It increased school-based health center referrals, utilization, and increased buy-in and support from school and communities. We hope this webinar series and upcoming toolkit will provide you with an introduction to see these new skills and partners, and to give you tools to be a part of this shift. We hope it'll provide you with an understanding of what Hallways to Health sites were able to do, how they got there, and give you the tools so that you can be pioneers for this model of school-wide wellness as well. We understand that this might be a lot of content with a lot of process-oriented thinking and a lot of time spent building new relationships. It'll be worth it. And while we understand that school-based health centers may not always be the lead on this effort, we still encourage you to be involved in these efforts. You can even help to promote and uplift what others are doing. It might even be undertaking school-wide thinking as a part of your clinical staff, and identifying other wellness champions to begin to uplift this work as well. We also want to say that we understand that the Hallways to Health sites were given specific funding and time and accountability to work on these types of efforts. So we know that you need to take on these efforts according to what's comfortable for you and what's possible within your school environment and system. And definitely, folks have been sharing in the chat box that the types of collaboration that the school-based health center was involved in the video was really awesome. And in fact, we will be talking more about that in our second webinar. So we wanted to share with you the general steps towards school-wide wellness that our Hallways to Health sites took to begin this cohort. Building your wellness team, and engaging partners like youth, parents, and school leaders, faculty, and community-based organizations, and the piece about collaboration that one of you just mentioned in the chat box, that plays a large role in our toolkit. We'll also address how to assess the conditions for wellness in your school, talk about planning your actions and implementing, and even sustaining your work. On our next webinar, we'll talk about building your school wellness team and strategies to engage with each of the different partner groups that I mentioned. We'll provide best practices and strategies for engaging these audiences and in your school-wide wellness efforts. And what you see here is a snapshot of what our landing page of our toolkit will be like. So it'll provide you with this visual index of each of the different sections that will be in our toolkit. And then for each of the different sections, as we click into the Build a Wellness Team section, you'll see some information, some background information.
You'll see a list of best practices and tips. You'll see some resources linked in each of those sections as well. And you'll get to read some stories from the field. We'll also have videos, just like the one you saw, in each section, as well as tools and resources that we use during the Hallways to Health initiative, as well as sample policies, procedures, and documents that our Hallways to Health sites created as a part of the initiative. So we're very excited for our toolkit, and we will send more information following the webinar about our anticipated launch date for the toolkit as well. So other opportunities to learn about building a team and engaging your partners. We'll meet again next Tuesday at the same time for a webinar. And then again, we'll talk a little bit more and get into each of the sections for assessing the conditions for wellness and planning your actions on Tuesday, May 8th, as well as talking about the importance of codifying and institutionalizing your school-wide wellness efforts or sustaining them in our final webinar on Tuesday, May 15th. We hope that you will join us for each of the next 3 parts of the webinar series so that you can get a little bit more detail on each of these sections of the toolkit.
All right, great. Thank you so much, Jordana. We want to give everyone now the opportunity to enter their questions. So please enter any questions that you have into the chat box. We do see a couple have been entered, and we will ask those questions following just a few announcements that we have. Our first announcement is about our membership here at School-Based Health Alliance. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable programs, timely publications, and networking opportunities. So please take a moment after the presentation to visit www.sbhforall.org/membership for more information to join. Also, with our membership this year, you will get a discount to our 2018 National Convention. So please join us in Indianapolis, Indiana this year. As the premier national gathering for our field, the convention is a fantastic opportunity to connect with hundreds of fellow school-based healthcare professionals and advocates from across the nation. And also, Jordana will be presenting on promoting schools as hubs of wellness, the Hallways to Health model. She'll be joined by Manny LeBlanc from Washington School-Based Health Alliance in introducing the Hallways to Health toolkits, key steps to using the population health approach, and provide tools, resources, and more examples to help SPHCs build, assess, implement, and sustain these efforts. And also like to mention our held at the annual convention is the Be the Change Youth Training Program, which brings together young people aged 14 to 18. Each year, students from across the country come to network with each other and school-based healthcare advocates and participate in various workshops pertaining to health, education, policy, and leadership. For more information is available on our website, and scholarships are available. Again, please join us this year at our 2018 National Convention. We would now like to open it up for questions from our participants.
Great. So the first question I saw in the chat box is, how do you provide support to school employee wellness initiatives? What a great question. And that's one we didn't really touch on very much today. One of the main things that our Hallways to Health sites did is also kind of created school employee wellness teams. So teams of teachers and other school faculty who were really interested in making sure that school employee wellness was something that was taken care of as well. So each of our Hallways to Health sites sent out a survey to their school employees to kind of assess their needs. What were their needs around healthy eating and active living, around social and emotional health, around feeling connected to their jobs and the school. And we provided a wealth of resources and approaches and tools to each of these wellness teams to get them going. We saw a lot of different types of wellness efforts that focused on school employees. So school employees and wellness teams joined together to have fitness, like my fitness pal or walking competitions, to have salad day lunches, to learn conflict resolution skills and mediation themselves. School-based health centers also provided, and this is one of the things that happens most often, is that the school-based health centers are providing professional development days to school employees on student social and emotional needs. So also talking to school employees about their own stress management and how to address students with trauma, and also take care of themselves and self-care during those times as well. So when we showed the story about Northwood High School, who has that big mindfulness program instead of as an alternative to detention and suspension, that they're working this year actually to do a big train the trainer model. So they're training the school employees to learn how to do mindfulness themselves, and then how to provide them in their classrooms. So a lot of other great school employee wellness efforts and examples will be in our toolkit. Next question is, what kind of conflicts are being referred to the school-based health center? This is a great question. And again, this speaks to coordination and integration of the school-based health center within the school. So one of our sites, for example, was working with the attendance team to identify the most truant students who were chronically absent. And the school created an opportunity for the school-based health center to work with those students as and work in a group setting, and to kind of get some counseling and explore a little bit more what might be causing that truancy. So that's one example. Other examples are, for instance, at the elementary school level, where there's bullying or playground conflicts. Oftentimes administrators are referring to the school-based health centers as well, because we know that there's a social and emotional component to those behaviors, and probably an underlying rationale for why a student might be exhibiting certain behaviors as well. So school-based health centers have really been involved in thinking about how to change infrastructure and policy to support these academic outcomes. And the school administrators are bought in because they know that it will impact not only health, but the academic outcomes as well. Absolutely, great. We got one more question about getting a copy of the slides. We will be sending a follow-up email, and there will be a link to the recording, and our slides will be posted on our website.
Yep, in 3 to 5 business days.
Thank you so much. Okay, wonderful. Well, thank you all so much again for your questions, and for joining us again on part 1 of our Hallways to Health webinar series. We'll look forward to seeing you next week. But before we go, it would be wonderful if you could take this final poll to evaluate this webinar session.
Thank you. Yes, we just have a few questions for you. Did the presentation meet your needs? How well do they meet the stated objectives? How likely are you to apply this information from this presentation in your organization? Did the presentation provide usable ideas and techniques that are relevant to your work? And was the presentation delivered in a well-structured and interactive manner? So you can please take a few moments to answer these questions. Thank you so much. And once the question comes up, if you click the next button, it'll send you over to the next question. Okay, great. Thank you so much. And again, we would like to thank my colleague, Jordana. Is there any last things you want to conclude for the webinar, Jordana?
No, thank you so much. I look forward to seeing most of you in the following webinars. Thanks so much. And feel free to invite other colleagues who you think would benefit from this information as well. Next week, we'll be hearing from Sarah Trevette as well, who is one of our wonderful Hallways to Health champions in Albany, Georgia.
Thank you so much, everyone, and have a great day.